Please state your name.
My name is Michael Chambliss, and Chambliss is spelled C-H-A-M-B-L-I-S-S.
Dr. Chambliss, how are you employed?
I'm at the present time employed in California in Fresno at the Fresno County Coroner's Office as a coroner's pathologist.
And can you tell the jury what a coroner's pathologist does?
A coroner's pathologist is actually a forensic pathologist who performs autopsies at the request of the coroner to determine the cause of death as well as the manner of death.
And what sort of education and training do you have which qualifies you for this position?
The educational background starts off with the completion of college. I completed my college training at Western Illinois University. It was in 1974. Then I entered medical school at Southern Illinois University School of Medicine in 1975 through 1979. In 1979, I entered a residency program in Chicago at Michael Reese Hospital in pathology, in both anatomic pathology and clinical pathology. It lasted for 4 years. At the completion of that training in Chicago, I entered a residency program at the Cook County Medical Examiner's Office in forensic pathology, which lasted from 1984 through 1985. In 1985, I became employed at the Cook County Medical Examiner's Office as a deputy medical examiner.
And how long did you remain at Cook County?
I was in Cook County until November 1991.
And then where did you go?
In 1991, I went out to Fresno, California for the first time and joined a private pathology group in which my duties were primarily to perform autopsies in the forensic area. It was a 9-man pathology group. I was one of 3 forensic pathologists, and I was there in the group from November 91 through about July 93.
And then where did you go?
I remained there in Fresno looking for a position because at that particular point in time, our pathology group lost a few contracts with a couple of coroner's offices, which happens. And I stayed and worked at the Fresno County Coroner's Office from July 93 until at the very end of 93, December 93.
And then where did you go?
I returned to the Midwest in January of 94. I took a position at the Waukesha County Medical Examiner's Office, where I was the medical examiner there, I believe from 1994 through the very end of 1998.
So at the time of Julie Jensen's death in December 3rd, 1998, you were still employed at the Waukesha facility?
Yes, I was.
And how is it that you, at some point you called performing an autopsy upon the body of Julie Jensen?
Yes, I was. We had an agreement, Kenosha Medical Examiner's Office and the Waukesha County Medical Examiner's Office, and more of a coverage agreement. If the Kenosha County Medical Examiner was unavailable for some particular reason, they would contact me at the Waukesha County Medical Examiner's Office, and I would come down and perform autopsies for them.
And you did an autopsy on Julie Jensen?
Yes, I did.
I showed you this exhibit that's been marked as Exhibit S7. And I asked you to identify this document, sir?
Exhibit S7 is a copy of the autopsy that I performed for Kenosha County on Julie Jensen.
And when did you perform that autopsy?
The autopsy was performed on December 4th, 1998, somewhere around 2:30 p.m. at St. Catherine's Hospital in Kenosha, Wisconsin. And these pages represent the preliminary autopsy results that I had at that time.
Now, Dr. Chambliss, both before and since that time, you performed perhaps hundreds or thousands of autopsies, correct?
That's correct.
Do you have a specific and independent recollections are sitting here today of the autopsy you performed on Julie Jensen back in December of 1998?
I do recall performing the autopsy back in 1998. I don't recall all the details of the autopsy. I remember the people in attendance, and I recall some of the findings from the autopsy.
And as you're conducting an autopsy, is it your habit or is it your routine to make notations or dictate notes as you're proceeding along?
My format of recording information from the autopsy is to go through the procedure and have either diagrams or notes nearby and jot those particular items down during the performance of the autopsy.
And then upon completion of the autopsy, you prepare an autopsy report?
Yes, I do, and it depends upon the information gathered from the autopsy. If it's an autopsy that I have an obvious cause of death, then I'll put at the end of the report the autopsy findings, and at the conclusion of that, I would put down the cause of death. If I don't have a cause of death, I will put down pending further studies or information, and that's what was done in this case.
So, doctor, at the time that you prepared the autopsy report that sits before you and is marked as State's Exhibit, as Exhibit S7, were the matters still fresh in your mind at the time that you prepared this report?
They were still fresh in my mind at that point, yeah.
And did you endeavor to ensure that the contents of this report were accurate as you were preparing it?
Yes, they were.
And is this a report, this kind of report, something that you would normally rely upon in the course of your duties as a medical examiner?
Absolutely.
Now, would it assist you, doctor, in the course of your testimony to be able to refer to Exhibit S7 from time to time as you're providing testimony in this case?
Yes, it would.
Tell the jury what you do when you conduct an autopsy.
In the performance of an autopsy, it includes both an external examination and an internal examination. During the external examination, we record the overall appearance of the individual, the height, the weight, the clothing items, hair color, eye color, any particular findings that would identify this individual if later on someone were to check for identifying features. After we do that, we'll take photographs commonly to document what we see during the external examination. We will record findings of injuries, we'll record scars, we'll record tattoos, anything that helps us to show not only injury but documentation for identification. It's then followed by an internal examination. The internal examination then makes the case an autopsy. We make a professional Y incision, we reflect skin and underlying soft tissues, and we examine again for the presence of any injuries over the chest wall or inside the body cavity. We document that information, and we continue by entering the chest cavity, looking at the items present in the chest cavity as far as injury or any particular pathology that we would notice in either the chest area or abdominal area. Also, during that portion of the procedure, we'll draw fluids. We'll take blood, we'll take urine, we'll take any other additional fluids that we may utilize in a case later on to help us determine the cause of death. Following that, we'll do an examination of the head area for the presence of any injury on the outside of the skull or undersurface of the scalp. And then we go inside the head area to examine the brain. We then weigh all the organs. We examine all the organs individually. We'll take samples of the organs. At that particular point, we document all of our findings. We will then take all of the particular items that are present for toxicology and package them up and submit them for toxicology.
Now, and Dr. Chambliss, as a forensic pathologist, can you distinguish between what a forensic pathologist might do as opposed to what a normal, any other type of a pathologist might do?
Well, there are two, I guess, categories of pathologists. A forensic pathologist is an individual who specializes in the field of anatomic pathology and has training in specific types of deaths, usually deaths due to obvious violence, overdoses, accidents, homicides. And that's a specific type of training as opposed to a hospital pathologist who is trained the same way during the pathology residency program, but they work primarily on hospital cases. A major difference is a forensic pathologist relies upon outside information, primarily toxicology results, investigative reporting, x-rays, other particular items that help us put together the entire case to come up with a cause of death as well as a manner of death.
Can you tell the jury what the difference is between a cause of death and a manner of death?
A cause of death, for example, is a heart attack. A manner of death is the process in which that particular cause of death took place. If you have a gunshot wound to the head as a cause of death, a manner of death is generally one of at least 5 categories. You'll have a suicide, an accidental cause, you'll have a homicide cause, you'll have an undetermined cause. In some other situations, you may not have any particular way that you can determine that, but primarily suicide, accidental, homicidal, and undetermined. So you look at the information that's provided on the case, you utilize the information, the story that comes along with it, and you determine if that gunshot wound case falls in the category of a suicide or a homicide, or if it's an accidental case. So it's the utilization of the other information that helps you sort through a manner of how this death occurred, and that process is what we sort through at the end of the autopsy.
Now, Dr. Chambliss, can you tell the jury what your findings were as you conducted the autopsy upon the person, or after you conducted the autopsy upon the person or the body of Julie Jensen?
Well, essentially the autopsy findings were on the outer surface of the body, or during the external examination. There were very few findings whatsoever. There was a small bruise on the front of her right shin or right lower leg, the front of her right lower leg. There were 2 horizontal bruises over her right buttock area. There is a very superficial yellow-brown type abrasion on the right side of the front of her neck. And that was all the findings noted on the external examination. When I went inside and did the autopsy portion of the, or completed the autopsy, did the internal exam, there was some hemorrhage of the soft tissue and muscle on the outside of the ribs on the left anterior, second, third, and fourth ribs. So there was obvious area of hemorrhage on the left anterior chest wall. When you go inside the chest area, there were noticeable small pinpoint size hemorrhages that were present over the outside of the lower lobe of the left lung, on the outside of the sac around the heart, and on the front and back of the heart, as well as the top of the right part of the diaphragm. These are what we call petechiae, and they take up particular significance as we find them quite often in cases of asphyxia. But it has to be under the particular conditions in which no other factors could be associated with petechiae.
So, Doctor, now at the time that you were performing this autopsy, did you have these other sources of information that you're making reference to, such as police reports or witness statements or anything like that?
No, I did not.
The investigation was still ongoing at the time that you performed the physical autopsy on the person of Julie Jensen?
Yes, it was.
And could you, using your own neck, could you point to your own neck and show us on your own neck where the mark was on Julie Jensen's neck that you're making reference to?
With using me as a model, with reference to where was approximately a half-inch curved yellow-brown superficial abrasion on the right front of the neck. around the location of what would be considered the Adam's apple area on the right front of the neck.
And Your Honor, I'd request the record show the witness was pointing to his neck about 3 or 4 inches below his right ear.
Yeah, any objection to that characterization?
I don't, but I also think his description sort of spoke for itself where he was pointing.
I'm talking about
Well, for the record, it's noted.
Thank you. Now, when you first observed the body of Julie Jensen was laying in the morgue and she was nude and you observed her on the table, is that correct?
No, she was not nude at the time when I saw her. As a matter of fact, in my first page description, I elaborate upon all the clothing items that she had on at the time she was there.
At some point toward the bottom of the first page, you make reference to an external examination, and you described her as a slender, well-developed adult white female with an estimated body weight of approximately 110 pounds, measuring 65 inches in length with an appearance consistent with the recorded age of 41 years. Is that your recollection? Is that the way she looked to you?
Yes, it was.
And at the time that you estimated her weight, was she clothed or unclothed at that time?
At that particular time, she was unclothed.
Now, by the time you performed this autopsy on December 4th, 1998, you have an estimate of how many autopsies you performed?
At that particular time in 1998, over 2,000 autopsies, I would say.
And how many would you say you performed by now?
As of this past December, close to 4,000 probably.
How many autopsies have you performed on a person who died as a result of ethylene glycol poisoning, including this one?
I do recall one case of ethylene glycol poisoning, and I have a faint recollection of a second, but I don't recall the particulars of the second case whatsoever. So it would be at least exposure to 2 other cases.
So, but it's an unusual cause of death.
It's a very unusual cause of death.
And at the time that you examined Julie Jensen, you did not come to a conclusion as to the cause of death.
At that particular time, in the completion of the autopsy, I had no cause of death.
Now, directing your attention to the section of your autopsy report entitled the genitourinary system, you describe the right and left kidneys weighing 100 and 120 grams respectively. You indicate that the capsules strip with slight difficulty, revealing very congested, smooth, red-brown external cortical surfaces. Can you tell the jury what is significant about that, if anything? What would cause them to be very congested?
Well, it's engorgement with blood. And the kidneys, in a number of different processes, will become engorged with blood because of it's one of the main sources of blood flow to the body, in addition to the heart and to the brain and to the liver. So it would be totally engorged with blood. And in this particular case, congestion at this particular level is nonspecific. I have no particular route that I can go on it. It says to me that we do have quite a bit of blood flow there. We have to look at microscopic sections to see if there's something additional that would be helpful.
And then you conclude that paragraph by indicating urinary bladder is distended with approximately 150 cc's of urine, and a small amount of white residue is present over the bladder mucosa, which is otherwise normal. Can you tell the jury what you saw and what's significant about it?
Well, the urine level is not as much significant as what you look at on the bladder mucosa. The bladder mucosa having a white residue on it, it's the lining inside the bladder, means that there is a deposit that came out of the kidney itself through the ureters down to the bladder itself, and it's like a sediment at the bottom of the urine. And the sediment went down on the lining of the bladder. So that white residue is a significant finding because we don't see that. We very rarely at all see any type of sediment in the bladder itself.
So, in view of what you observed though during the course of this autopsy, you were unable to come to a conclusion as to the cause of death. Can you tell the jury what you did in terms of collecting tissue or liquid samples from this body?
With reference to tissues, each organ that I examined, there were sections taken from those representative sections and placed into formaldehyde and saved for further examination. And in this particular case, we would take those sections, make them in the appropriate size for examination under the microscope. So that is what was done with each organ as far as the tissues were concerned. As far as toxicology was concerned, I drew blood from two locations, one from the right side of the heart and one from the right femoral artery. So you have two separate locations where blood was drawn. Urine was taken, a sample of brain was taken, liver was also taken, subcutaneous fat from the abdominal wall, and a muscle sample from the anterior abdominal wall. Also, gastric contents, there was 660 ml of gastric contents, but as I was reading through my report, I noticed that there was no gastric contents that I had recorded and saved for toxicology. And later on, I realized that there was gastric contents, about 100 ml of gastric contents that was saved.
And you also took samples or portions of the kidneys and preserved those?
Those were all taken during the examination of every organ. They would have been saved in formaldehyde for further examination later.
Now, once you obtain these samples, both the toxicological samples and the pathological samples, do you store them or place them in such a way that if another person were to come along later, they would be able to identify the origin of the items that had been taken from the body of Julie Jensen?
Yes, we do. The toxicology specimens are sent off to a properly packaged, labeled as to which particular organ they came from or what they are, if they're urine or blood. Or gastric contents. They're properly labeled, placed into the containers that the particular toxicology lab utilizes, and we send that material to them to start their toxicology studies. The tissue samples that are taken when we examine each organ are placed in formaldehyde, and they are kept stored in the particular hospital until a later time when we will cut those for microscopic slides, or slides that we can look at under the microscope.
Now, you never examined any of the pathological samples under a microscope, is that correct?
That's correct. I did not participate in that.
Now, at some later time, did you become aware that that there were kidney sections that were examined under a microscope?
Yes, I was.
And did you become aware that they contained oxalic acid crystals in the kidney tubules?
Well, no, I'll let it go. That's fine. I withdrew the objection, Dr.
Okay.
Chambliss.
That means you can answer the question, sir.
Yes, I did become aware that the kidney tubules contain oxalic acid crystals.
Now, doctor, do you have, as you're sitting here today, do you have an opinion to a reasonable degree of medical certainty as to the cause of death now, in view of the fact, I'm not talking about the manner of death, but the cause of death, in view of the fact that there were oxalic acid crystals within the kidney tubules?
The presence of oxalic acid crystals in the kidney tubules are very characteristic of ethylene glycol present in the system, in the tissues, an abundant amount of ethylene glycol in the tissues.
Now, when you examined the body, you were not at the scene where Julie Jensen's body was discovered, is that correct?
That's correct.
At the time that you examined Julie Jensen's face, at the time that you conducted the autopsy, did you notice any distortions about the face or about the nose or about the mouth?
And not when I as recorded in my autopsy report. I didn't record anything specific about her face or nose or anything.
We'll tie it. Now, Dr. Chambliss, I show you this photograph that has been marked as Exhibit S8 and ask you if that photograph appears to be the person Julie Jensen.
Exhibit SH does appear to be the photograph of Julie Jensen.
Now, you'll notice that the nose and the mouth are pushed off to one side in that photograph.
Yes, they are. They're pushed off to her right in the photograph.
And her mouth and her nose did not appear like that at the time that you conducted the autopsy. Is that correct?
I didn't record it as being that way, so I don't have an independent recollection that it was different than the way I recorded it.
But that would be an unusual finding, wouldn't it? That's an unusual presentation for a face to look like that at the time that you conduct an autopsy.
Well, it would require more information to help me determine what would cause the distortion in the face.
Would you normally expect to find that kind of distortion in the face of a person who is found lying on her side with a face in a pillow?
Not normally.
Now, Doctor, if you said that at the time that you're looking into the cause or the manner of death, you consider not only what you see at the time of autopsy, but you also consider witness statements. Is that true?
That's also true.
I'm going to pose for you a hypothetical question, and I'm going to ask if you have an opinion to reasonable medical certainty. If you had read a witness statement where the witness indicated that Mark Jensen said that he came home and found Julie Jensen, that her breathing had actually improved, and he needed to kill her. So he sat on her chest, on her side, and forced her face into a pillow and smothered her. Is there anything about your autopsy findings that would be inconsistent with that description of the cause and the manner of death of Julie Jensen?
Nothing inconsistent with what I've found in the autopsy.
I forgot to turn on. Thank you, Doctor. I have no further questions.
Mr. Albee?
Thank you. Good afternoon, Mr. Chambliss. Dr. Chambliss, sorry.
Afternoon, Mr. Sullivan.
Let me just ask you whether your findings would be inconsistent with the suicidal poisoning and considering the additional information that you had that there were oxalic crystals in the kidneys.
Again, that depends upon the information provided investigation-wise. I do have, with the information provided, it tells me that we have ethylene glycol in the individual system, in the tissues. It then requires a toxicology level with particular tissue toxicology levels, and then plus investigation together. So I utilize all three in conjunction.
Sure.
So I can't say just suicide just from autopsy findings.
But my question is, from the findings that you have and the additional information you were told that there are oxalic crystals embedded in the kidneys, that would not be inconsistent with a suicidal poisoning of ethylene glycol, right?
I can't say it's inconsistent because I don't have the next arm of the information that's necessary. You can't determine a manner of death by excluding investigation. That's what we do for forensic pathology. You have to have investigative information to determine the manner of death.
And just as the hypothetical posed by Mr. Jamboys, you don't have any information about the credibility of that witness in that hypothetical, correct?
That's correct.
And that's something that you'd have to examine very carefully, is the credibility of the witness providing such information, true?
Well, it would require the investigative arm that's helping me in that particular case, which would be the police department and any outside agency. So that's up to them, actually. The credibility doesn't, I would leave that to them.
Well, Dr. Chambliss, if the person who provided that information is not credible, then you can't rely on it, right?
I'd have to put it in an undetermined manner.
Right. And you understand that juries determine the credibility of witnesses, right?
That's correct.
And you were the original medical examiner in this case?
I was the original pathologist to do the autopsy, yes.
And you have never issued any report at any time with the cause of death, correct?
That's correct. This is merely my preliminary.
I'm gonna ask you, Dr. Chambliss, I don't mean to be rude, but if possible, if you can answer the question with a yes or no. I mean, you understand how the cross-examination process works.
But sometimes if I can, I can. If I can't answer it as a yes.
Absolutely. And if you can't, you can't. But if you
Okay.
can, I'd ask you to. Thank you.
Okay.
And you've never issued any report with a manner of death, correct?
That's correct.
This was turned over to Dr. Maureen Lavin, correct?
That's correct.
And she was the medical examiner in Kenosha County at the time?
Yes, she was.
When did you turn over this case to, or give it back to the Kenosha County medical examiner, Dr. Maureen Lavin?
I don't have an independent recollection of the date I turned it over.
Within a month?
I really don't recall at all.
Was it more than 6 months? I mean, or do you just have no memory at all?
I just don't have any memory of it at all.
Do you remember any activities you undertook after doing the autopsy and preparing your report?
Other than preparing the report, I had a discussion with her about the case, but that's the only additional thing that was done.
You didn't do any follow-up microscopic examination, right?
No, I did not.
You didn't do any follow-up toxicology, right?
Well, it would not be my part to do toxicology, but I didn't initiate that.
You didn't send out any toxicology samples, right?
No, I did not.
So your involvement in this case was pretty much done as of the time you issued the report for your activities on December 4th. Fair to say?
That's fair to say, yes.
As a medical examiner, would you agree that it's important not to start out with any biases in your examination?
Exactly.
You need to be as objective as possible.
I would agree with that, yes.
And if you start out with some bias or you're not objective at the outset, there's a risk that you're going to miss something important.
Well, you will be pushed down one particular route, yes.
And you might see something that's not really there.
I don't know if you might see something, you may not include everything for the case.
I mean, there are some things where you have to make a judgment call as a forensic pathologist, right?
It is a science in which we do make judgment calls, yes, so we'd have to.
And sometimes the bias that you go in with could affect which side of a judgment call you're on.
A bias can affect one way that the case goes, yes.
Now, excuse me for a moment. Let me see if I can get a clean report.
Could you see if you can find 1179? This is his report for me.
In terms of external injuries, there were only what you call a few minor blunt trauma injuries, correct?
They are minor blunt trauma injuries, yes.
And this what did you call it, curved
It's a curved, yellow-brown superficial abrasion.
Okay. And I think you referred to it in your direct testimony as very superficial, correct?
Yes, I did.
That means, superficial means not significant, true?
Well, you can't necessarily put it as not significant, but you have to put everything else additional in that location.
But that's what superficial means, is it's very surface level.
It means it's surface level, but it doesn't mean it's insignificant.
Okay. And that could have, I think you identified that mark as being perimortem, which means around the time of death, is that right?
That's correct.
And it could have been from medical attention or transport that she received immediately after death, true?
If she were transported and I had that information, what I see from my autopsy is just EKG pads. So I see no additional medical intervention on her body.
Well, somehow she got to your location, right? You didn't do this at the Jensen home.
I agree.
And so it could have been somebody moving her or that was tending to her at the scene, correct?
I have no idea.
It could be, right?
I'm not going to say it could be or not. They may not handle her neck area. So I can't say one way or the other.
Well, I guess what I'm getting at is it could be somebody handling her after death. I'm not asking you to say that that was the situation, but if somebody touched her neck who was handling the body after her death, that could cause that kind of mark, true?
That may be a scenario that could possibly produce it.
So the answer is yes, Dr. Chambliss?
It's possible.
Now, and what you wrote in your report is that the nose is midline. What does that mean, Dr. Chambliss?
It means it's top to bottom vertical.
It's not bent at all.
Not bent at all from the way I described it in my report.
And you would have described it accurately, true?
I would anticipate that I did, yes.
No reason to doubt your competence at evaluating the nose, right?
No, that's correct.
And you said the cartilages are intact, right?
Yes, that's correct. I did say that.
So there's absolutely no damage to the nose that you observed.
There's no cartilaginous damage to the nose, yes.
And the nose being midline is another indicator that there wasn't any damage, right?
Yes, it indicates that it's not distorted, obviously, to me at the time.
And there weren't any nasal abrasions that you noted, true?
That's correct.
The inside of the lips and cheeks showed no injuries, right?
That's correct.
Sometimes when someone suffocates, they bite down on their lips or cheeks, and there can be injury, right?
I would say 95% of the time, no. You don't find any injury at all.
So that would be sometimes you could have that kind of injury when you suffocate, right?
I would say out of the cases that I've seen for those, absolutely no.
Well, a moment ago, it was 95%. Now we're down to 0?
I'm just saying the
5%?
cases that I've seen,
Okay.
no.
Well, you study besides just the autopsies that you yourself do, correct?
I've actually lectured on asphyxial deaths, yes.
Again, you know how this works, right? You've testified thousand times?
I would say 1,000 times, yes.
And you try answering the question, so you know some of this is just foundational. You understand that, right?
Yes.
And in the studies or your teaching, I mean, if there were marks to the lips or the cheeks, you would consider that as a potential sign of suffocation, correct?
If it's useful, yes. If it applies in that particular case, yes.
Right. If you saw teeth marks in the lips, you would say that it's possible that that person was suffocated. You would look further at that, right?
I'm trying to answer your questions, Counselor, and I'm telling you, in the years that I've done suffocation and smothering, I don't see it.
And I'm not asking about what you've seen. Is that something that you would take as a signal that somebody may have been suffocated if you saw that?
Objection, Your Honor. This question has been asked and answered numerous times.
It's something you can see, yes.
And other than that little abrasion, that very superficial mark, there was no other neck injury, right?
That's correct.
No other marks on the neck whatsoever.
That's correct.
The other bruising you observed is there were 2 bruises on the butt,
That's correct.
and those would be consistent with, for instance, bumping into a table.
That's one possible way they could occur.
And so the answer would be yes, that is consistent with bumping into a table.
It is consistent with that, yes.
And then there was just a bruise on the right shin, and I take it that could be from bumping into just about anything.
But that's also consistent with bumping into a number of things.
Okay. And I take it none of the bruises on the butt or the shin were of any particular significance in trying to determine cause of death here.
No, they were not.
And there wasn't any fluid in the nose either?
No, there was not.
Correct? The eyelids were free of petechiae?
That's correct.
And I think your autopsy indicated that there were signs of medical attention to the chest. Is that right?
Just one second. That's correct.
And there was no evidence of any trauma to the chest.
That's correct.
And trauma is some injury by an external force?
Yes, that is correct.
So there was no sign of any external forces to the chest?
That's correct.
No evidence of trauma to the abdomen?
No evidence of trauma to the abdomen.
No bruising on the chest, correct?
No bruising on the chest.
No rib fractures?
No rib fractures.
And you described some petechiae in the soft tissues of the ribs. That would not be inconsistent with being a post-mortem artifacts, correct?
I don't think I called it petechiae in the ribs.
Under internal examination, at page 3 of your report, about halfway down that page, it says, upon reflecting the skin and underlying soft tissues, there's a small amount of hemorrhage involving the soft tissues and muscles attached to the left, second, third, and fourth ribs anteriorly.
That's hemorrhage, not petechiae.
Okay, my mistake. And those would be consistent with post-mortem artifacts?
I can't say that that's post-mortem artifact.
Can you rule that out?
I can't say because I didn't examine the muscle microscopically. You need to do that.
Right. So you can't rule out that this is just post-mortem artifact, right? Because you didn't do all the work.
I agree with that, yes.
There's absolutely no evidence that there's any strangulation here, true?
I see no findings of that, yes.
Now, the stomach was very dilated.
Yes,
It extended into the lower pelvis.
yes, from my description at the autopsy.
And do you recall how far into the lower pelvis the stomach extended?
Not independently, I'd have to, I don't even really recall how far down.
Do you recall how big the stomach was?
Well, the stomach size is actually dependent upon the amount here, so 660 ml of fluid is a significant amount of fluid, but it expands with the size of the amount of fluid.
And how
So I
did-
can't determine that.
How did you measure those contents?
You pour it directly into a measuring cup, and you get the level of contents or the amount present in that particular structure, the stomach.
And did you make any effort to determine whether there's an ileus?
There is no ileus because I described the sizes of the small and large intestines, and an ileus would, from the appearance that's here, you can't determine that as being an ileus.
And does the distended stomach suggest to you that there may have been some delayed gastric emptying?
That suggests that the stomach hadn't totally emptied. It doesn't tell me anything more than that.
Does that suggest the possibility of delayed gastric emptying?
No.
And you noted that she had a fatty liver,
Yes.
and a fatty liver is something that may slow the metabolism, correct?
I can't agree with that, no.
Okay. The, so it's your testimony that a fatty liver would not affect the metabolism?
It affects the metabolism of some items and some drugs, but to say overall it affects totally the metabolism, I can't agree to that.
There is no aspirated food material in the respiratory system?
That's correct.
And the petechia in the cardio area would be consistent with increased blood pressure while dying?
No.
You disagree with that?
Yes.
Now, your report does not indicate that you saved any gastric sample, right?
That's correct.
And you have no independent recollection of doing that, right?
That's correct.
So from your notes, and you have no notes apart from this report that would indicate that you saved gastric samples.
No, I do not.
Now, you mentioned somehow that you learned later you saved 100 milliliters. How was that determined?
Objection, 100 milliliters of what?
Of the gastric contents?
I was made aware of the toxicology results and the amount of gastric contents that was saved.
All right, well, somebody told you that they had 100 milliliters of gastric contents that they related to this case. That's what you're saying?
Yes, that's correct.
But you're unable to say even whether the gastric contents were saved and how that was done?
I can't tell you independently right now. It's not recorded in my report. That's the only thing I can say.
There's no independent recollection and there's no recording of that fact. True?
That's true.
You did note that in your examination of the gastric contents that there was potato and pepper?
Yes, there were identifiable food fragments that I could make out.
And based on those food fragments, can you tell when the last time Julie Jensen would have eaten prior to death?
No.
Can you give a range?
No.
Could it have been more than 12 hours?
I can't tell you.
Well, could it have been more than a week?
I can't tell you.
You can tell me it wasn't more than a week, right?
I can't tell you when the last time she had eaten.
Well, Dr. Chambliss, if she ate a week, if the potato and pepper it wouldn't be possible for the potato and pepper to have been there for over a week, right?
I agree.
So you could tell me that it was less than a week, right?
It's less than a week.
Is it less than 2 days?
I don't know.
It could be 2 days?
It depends on the state of the individual at the time when they ingested the food.
Okay.
So I can't tell without additional information.
Okay. But there are certain things that the human body can do, and there's certain things that are beyond any possibility at all. True?
That's true.
Okay. Could it be more than 2 days?
It could be more than 2 days if a person's in a coma. I've seen that situation. If a person's in a coma, they could be in a coma for 5 days, and the food is still the same way.
Okay. How about if they're not in a coma? Could it be more than 2 days?
Not generally. If they're functioning normally, it should not be there after 2 days.
Okay. And how about if they're not in a coma? Could it be more than 1 day?
Not generally more than 1 day.
And when you say not generally, I'm saying, could it be?
It depends on what else they have in the gastric contents with them. It can slow down the process of metabolism or breakdown of the tissue of the particular items that are there. So I need more information. It's not something you can make a flat statement about.
Well, what would slow down the metabolism so that it would be there for over a day?
Well, any type of toxin or alcohol or anything that could possibly do that. But there are a number of items that could do it.
So if there's a toxin or an alcohol, then the potato and pepper could be there for over a day.
That's a possibility, yes.
And what if the potato and peppers were consumed with a toxin? Would the toxins be there too?
It depends on the amount of food. See, there are too many items to just make a flat statement on. So it depends on the amount of food as well.
And understand, I'm talking about possibilities. So could a toxin remain for over 24 hours after the consumption?
It depends on the toxin. It really does. It's possible.
So the answer is yes, it's possible.
Yes, it's possible.
And would well, let me withdraw that. Now, you noted that the kidneys were congested, correct?
Yes, I did.
From your observation of the kidneys, you're not able to tell anything about kidney function, true?
Just congestion is very nonspecific. You can't tell function that way.
Right, so the answer is yes, you can't tell anything about kidney function?
Yes, you can't tell the function just looking at the kidneys.
Would you characterize the amount of urine in the system as being moderate?
It would be a moderate amount, yes.
Somewhere in the mid-range of what you usually see doing autopsies?
Yes, I'd agree with that.
That suggests that she likely had gone to the bathroom relatively recently? Well, and what in terms of the last time that she probably urinated, Julie Jensen urinated, what would you say?
I can't tell you. I don't have any idea.
Well, would you expect more urine if it had been, say, over 6 hours since she had urinated?
I can't say. I don't know what to expect at that particular point, so I can't say.
So you can't, and what would you need to know to be able to tell if
The information leading up to the time when a person dies. If they have a seizure, quite often we don't have any urine. And they may have a distended bladder at the time when they're dead, or right before they die, and they empty their bladder. The information is very important, and the amount is important.
You mean they emptied their bladder at the time they died?
Yeah, they'll have a seizure.
Now, you don't have, as to Julie Jensen, you don't have any information that there's any urine in the bed, right?
No, but you're asking me a question about, yes.
I asked you one question right now, and that is, you
Yes.
don't have any information that there's any urine in the bed, true?
That's true.
You don't have any information that there was any vomit in the bed, right?
That's true.
You don't have any information that there were any bodily fluids in that bed, right?
That's correct.
There weren't any bodily fluids in that pillow on the bed, right?
From what I know, no.
Right?
I said no.
And given that information, would you believe that she had urinated within 6 hours of her death? And you know the level of gastric contents as well.
I can't say because we have oxalic crystals in the tubules, which affects her kidney function. And when you have oxalic acid crystals in her kidneys, you can go right into acute renal failure, which limits the amount of urine that you put out in the first place.
So can you give me any kind of range in time as to when she last?
No, I cannot.
Could it have been 3 days?
I can't tell you.
I mean, the fact of the matter is, Dr. Chambliss, is you have not reevaluated this case to any great degree since you did the autopsy December 4th, 1998, true?
That's true.
I note that your autopsy also does not indicate that you collected any vitreous fluid.
That's true.
That's something that's done or is supposed to be done in every autopsy?
No, it's not supposed to be done in every autopsy. It
Okay.
can be done.
Did you collect vitreous fluid in this case or didn't you?
No, I did not.
So,
Let's see if you can find it. It's from St. Catherine's Hospital. There's vitreous fluid testing.
there are no scalp injuries in this case, right?
That's correct.
Now, you were given a hypothetical of somebody turning somebody over, right? Is that included in your hypothetical? Let me give you a different hypothetical. Let's say somebody is too weak to resist being suffocated, if that's the claim, okay? And they're on their stomach, all right? That's the first part. And they're turned over from their back onto their stomach, okay?
Okay.
Would you expect, that would require some pressure on the arms if that's how they were turned over, right?
Can you repeat that? Because I'm trying to visualize what your hypothetical is.
Okay. Let's say there's a person in a bed who's weak, out of it, and another person turns them over onto their stomach. Okay, you got that?
Yes.
Might you expect some bruising on the arms if that's how they turned them over?
From that, I don't expect bruising on the arms.
It's certainly a possibility, right?
It's possible.
And, I mean, you see that with hospital patients, right, who are frequently turned over. They'll have some bruising on their arms.
We're talking, in hospital cases, yes.
Okay. I guess we'll have to put that in later. At any rate, the task of determining cause of death was given to Dr. Morgan Lavin,
That's correct.
and you understand her to have been the one who issued the official cause of death for the Kenosha County Medical Examiner's Office in this case, right?
Yes, I do.
And you're not aware of any other autopsy report in this case other than Dr. Maureen Lavin's, true?
I'm not aware of any.
That's all I have.
Mr. Chambliss?
Now, Doctor, on cross-examination, you indicated that you would be unable to give us any insights into the manner of death without first getting toxicology results. Is that correct?
That's correct.
That's among the things you'd be looking at.
That's correct.
Now, by the way, Mr. Albee clearly knows a lot more about medicine than I do. I don't know what is an ileus. What is he talking about when he's referring to the ileus?
That's a slowing down of the contractile processes of the intestinal, so that actually the intestines look very distended and much water. So it slows down. That's an ileus.
Okay, kind of gets
Plugged up. The bit we draw out sometimes to do toxicology.
I'm going to have some items. And these 3 photographs. Results. This. And this. Do you need to get that all now, or can I take them? Thank you. Now, Doctor, oh, sure. Can I see the, can you hand me this other photograph? And here's the other exhibit, Judge. I don't know if you saw that.
I didn't see that.
Okay. Thank you. Doctor, I first of all want to go into this issue about the soft tissue hemorrhage adjacent to the ribs on the left upper anterior chest. Now, was this something that you observed looking at the body before you'd cut it open? And in other words, was this hemorrhage something that you could see before you'd retracted the skin, or was this something that you saw after you'd retracted the skin?
It's after I retracted the skin.
So from the outside, looking at the body, when you examined the body and it was still intact, you did not see this injury to the outside?
That's correct.
Now, can you explain to the jury what a soft tissue hemorrhage adjacent to the ribs on the left upper anterior chest, explain to them what that is, since we're not going to be showing them, because that would be retracted skin, correct? It would.
Well, you have skin, you have fat just beneath the skin, which is the beginning of soft tissue, the fat, and then below that would be the muscle over the front of the rib.
Photograph, and it tell the jury what it depicts.
Exhibit S10 is a photograph assumed to be from the scene of where Julie Jensen was. She's lying in her bed, face down, or face in a pillow with her left side below the pillow area. So she's face down in the bed.
And directing your attention here to Exhibit S13, that appears to be a photograph taken from the other side, is that correct?
Yes, it is. Exhibit S13 is a picture of the back portion of Julie Jensen, who's in which the covers have been pulled back so you can see the back side of her.
And Exhibit S12?
Exhibit S12 is a photograph, again, with Julie Jensen in bed. We're looking from the right side. Her face is in the pillow. You can see her chest, right arm, left forearm, and left hand. Her abdomen, we're looking at the right side of her hip and actually her right thigh. And the covers are partially pulled back. You don't see the full extent of her legs.
And the left arm is at sort of an awkward angle there, isn't it? Underneath her body, going downward toward her waist.
Her left arm is extending underneath her body, which looks like it's along her, passing along her left rib cage, along her upper belly, and going down towards her hip area, but it's in a very odd position.
And then Exhibit S11.
Exhibit S11 is a very close-up photograph of the head, particularly the face of Julie Jensen. We're looking again from the right side. The pillow is on the right side of the photograph. Her head is pretty much in the center of the photograph. The face and the nose, we see the nose bending into the pillow itself. And we see some fingers in the upper portion of the photograph in her hair area.
Now, Doctor, you testified under cross-examination that there is a small amount of soft tissue hemorrhage adjacent to the ribs on the left upper anterior chest wall as previously described. Now, would that be right up in here?
As you're describing, it's beginning below the clavicle on the front portion of the chest, and you go down about part way down in the breast area on the front of the left side of the chest.
Now, looking at Exhibit S12, the photograph that portrays her left arm under there, and I'm going to ask you this question now. Assuming that a person about the size of Mark Jensen sat on the right chest wall of Julie Jensen and shoved her face into the pillow, would you expect to find bruising or this hemorrhage, soft tissue hemorrhage, in about the location that you, in point of fact, found it at the time that you conducted this autopsy?
It would be consistent, the findings there, with what I see in this particular photograph, with the positioning of the arm and the location of the hemorrhage and the soft tissue on the left anterior chest.
And the manner in which you, now looking at the other exhibit where you've got the close-up of the face into the pillow, in the absence of pressure being applied to the back of the head, shoving it into the pillow, would you expect a soft pillow like that to cause that kind of mashing of the nose and the face off and the mouth off to one side?
No.
Under normal circumstances?
Not under normal circumstances, no.
Now, Doctor, you'd indicated on cross that unless you knew the tax results, you would be reluctant to offer any kind of an opinion concerning the manner of death. Is that correct?
That's correct.
For a purpose, Doctor, I'm going to hypothetically ask you to consider these to be the toxicology results that were obtained from Julie Jensen's blood, urine, and gastric contents. Now take a look at those for a moment, because I'm going to ask you a question about them. Now, Doctor, when you look at those toxicology results and then you take into consideration the fact that there were oxalic acid crystals within the tubules of Julie Jensen's kidneys, and further, that there were some oxalic acid crystals actually found in her brain tissue as well.
Objection. You'll introduce no proof of that.
Well, I'm going to let him go ahead with the question, and the jury is instructed and will be further instructed again at the end of the trial that if the doctor or any other witness, an expert witness, is supplied with some what are claimed to be facts, and it turns out that the facts are not proved in the case, you are to disregard the opinion in its entirety. Any question about that? Go ahead, Mr. Chambliss.
Thank you, Your Honor, but I forgot what my last question was, so I'll try to formulate another one that I hope is not objectionable. Have you examined those toxicological results, Doctor?
Yes, I have.
Now, hypothetically, assuming that those are the toxicological results that were obtained when the blood and urine and the stomach contents of Julie Jensen were tested for the presence of ethylene glycol, would you have an opinion as to the cause of Julie Jensen's death when you take into consideration the soft tissue injury that you discovered along the anterior portion of the left chest wall, when you consider the manner in which the face appears to have been mashed into the pillow, and when you consider the statement of an admitted jailhouse informant that Mark Jensen indicates that he'd poisoned Julie, that she was actually improving on December 3rd, that he panicked, so he sat on her, shoved her face into the pillow, and suffocated her. Do you have an opinion, as you sit here right now, Doctor, to a reasonable degree of medical certainty as to the cause of death and the manner of death, given those hypothetical factual situations, circumstances?
I have an objection, Judge. Required a sidebar.
Sidebars are discouraged.
Understand. It's, I guess it would fall under 971-23.
Well, let's take a break. Please don't talk about the case during the break. About 15 minutes.
Please all rise.
No smoking?
What's up?
Well, Judge, there's an effort to offer, the only opinions that we have of Dr. Chambliss are from December 4th, 1998. There's no notice that he's going to be providing any other opinions, and he's said he hasn't even examined the rest of this file. And I spoke with, not only is that all I got in pre-trial, I spoke with Mr. Jambois yesterday and Dr. Chambliss briefly this morning, and I think he's already given opinions beyond what's in his autopsy report that are significant, that warrant notice in order for us to cross-examine him properly.
Did you want to respond?
Your Honor, in point of fact, I didn't ask these questions on direct examination. I asked them on redirect, and it was based on the issues that were brought out on cross-examination. And I really had never paid much attention to the soft tissue hemorrhage adjacent to the ribs on the left upper anterior chest until Mr. Albee started asking questions about it. And it was also Mr. Albee who asked this physician about the the manner, the cause of death or manner of death. And the doctor replied that he would need he wouldn't offer such an opinion without a toxicological report first. And so I was simply supplying the witness with the items that he indicated were necessary in order for him to form the opinion that Mr. Albee had asked him to come to on cross-examination. And I don't see how I'm supposed to anticipate what Mr. Albee is going to ask on cross-examination, and thus I don't see how I'm supposed to know in advance what the witness is going to say. But in view of the manner in which the cross-examination went, there were a number of photographs that I thought became much more relevant than I'd thought they had been before. And even though I've been on this case for 8 or 9 years, remember Aaron Dillard's statement just came out a few months ago. I'd never really looked at that photograph until I heard defense counsel cross-examining this witness, and he was describing the injuries to the chest wall. There were no physical injuries on the outside of Julie Jensen's body. The only way these injuries became apparent is when this physician did the Y incision and retracted, or I don't know if they call it refracted or retracted the skin back, and he was able to see the injury on the left anterior chest wall in exactly the location where her arm, as you can see, is coming in such an awkward manner underneath her. You know, this is exactly why we have cross-examination in this court. It's supposed to be, in this country, it's supposed to be a pursuit of the truth. And little portions of the truth are going to come out during the course of the trial. Even if the defense counsel can't quite anticipate exactly what the truth is going to be, this is very compelling testimony coming from this physician and is very much indicative of the defendant's guilt.
Thank you. Did you want to respond, Mr. Albee?
Judge, well, I'm going to tell you, raise another issue at the same time, which is, I think there are going to be problems when these hypotheticals aren't borne out. I mean, I think that, you know, and that's what he suffers, but I think that you know, if he takes it too far, I mean, it's going to risk mistrial because he's really out on a ledge, I think.
Well, I agree with you that if it were a persistent problem, that it would have to be addressed. I do think that in this instance, matter of fact, I think he withdrew the objectionable part from the rephrased question, unless I misunderstood.
Well, first of all, if you're talking about the oxalic acid crystals in the brain tissue,
Right.
There were oxalic acid crystals in the brain tissue.
I don't know.
Well,
I thought he excised it from his second statement of the question. Did I misunderstand?
it's not an important part of it because the oxalic acid crystals start out in the kidneys and they only migrate up to the brain tissue. There were some migratory oxalic acid crystals in the brain tissue. Counsel has subpoenaed Dr. Lavin. She found him there, and I'm sure she'll attest to it if he calls her as a witness.
Well, to make it short, I would agree that if there are things which are components of hypothetical questions and there are persistent instances where it is something that is not borne out or is going to be borne out by the evidence, I'll have to deal with it, but I'm not going to entertain that kind of an objection at this particular moment. Insofar as the testimony beyond what may have been in a prior report, one of the evils of the reformed view, I'll call it, with prior discovery is that some people get the idea that what was intended as it is sometimes believed by some that what was intended as a protection against ambush means that there's a certain stopping point before the trial where after that nothing new comes up. That's not how the human mind works, and that's a huge disservice to the pursuit of truth to have things suppressed simply because they've not been thought of or discussed before. Oftentimes new areas of inquiry, which may be very fruitful, can be developed just by hearing the testimony or by hearing the examination by the other counsel. So I don't want to interpret the rules in such a way as to, as I say, freeze the evidence at some time prior to the trial and not let it become a lively pursuit of truth. So your objection is going to be overruled. Anything else now?
No, Your Honor.
No, Judge.
Okay, thank you. We'll be in break until 20 minutes to. Was that brain oxalic crystals in the brain? Is that?